Here's a detailed explanation of each of the 10 most common nutritional deficiencies. 1. Iron deficiency. Iron is crucial for the production of hemoglobin, the protein in red blood cells that carries oxygen. A deficiency can lead to iron deficiency anemia, resulting in symptoms like fatigue, weakness, pale skin, dizziness, and shortness of breath. Women of childbearing age, pregnant women, and individuals with heavy menstrual periods are particularly at risk. Sources of iron include red meat, poultry, fish, lentils, beans, and fortified cereals. 2. Vitamin D deficiency. Vitamin D is essential for calcium absorption and bone health. A deficiency can lead to weakened bones, increasing the risk of fractures and conditions like rickets in children and osteomalacia in adults. Factors contributing to deficiency include limited sun exposure, certain medical conditions, such as malabsorption syndromes, and dietary insufficiency. Sources of vitamin D include sunlight, fatty fish, fortified dairy products, and supplements. 3. Vitamin B12 deficiency. Vitamin B12 is vital for red blood cell formation, neurological function, and DNA synthesis. A deficiency can lead to pernicious anemia, characterized by fatigue, weakness, nerve damage, and cognitive issues. It's particularly common in vegetarians, vegans, and older adults due to decreased absorption. B12 is primarily found in animal products like meat, fish, eggs, and dairy. Those at risk may need to consider supplementation or fortified foods. 4th, calcium deficiency. Calcium is crucial for maintaining strong bones and teeth, as well as proper muscle function and nerve signaling. A deficiency can lead to osteoporosis, increasing the risk of fractures, particularly in older adults. Individuals who do not consume dairy products or fortified alternatives may be at higher risk. Good sources of calcium include dairy products, leafy green vegetables, tofu, and fortified plant-based milk. 5. Magnesium deficiency. Magnesium is involved in numerous biochemical reactions in the body, including muscle function, nerve transmission, and bone health. A deficiency can lead to symptoms such as muscle cramps, mental disorders, like anxiety and depression, and osteoporosis. Risk factors include inadequate dietary intake, gastrointestinal diseases that impair absorption, and certain medications. Sources of magnesium include nuts, seeds, whole grains, and leafy green vegetables. 6th, folate, vitamin B9. Deficiency. Folate is essential for DNA synthesis, cell division, and proper fetal development during pregnancy. A deficiency can cause megaloblastic anemia, characterized by large immature red blood cells, and can lead to neural tube defects in developing embryos. Folate is especially important for pregnant women. Sources include leafy greens, legumes, fortified cereals, and citrus fruits. 7. Vitamin A deficiency. Vitamin A is crucial for vision, immune function, and skin health. A deficiency can lead to night blindness, dry skin, and an increased risk of infections. It's more prevalent in developing countries where dietary diversity is limited. Vitamin A can be obtained from animal sources, retinol, such as liver and dairy, as well as plant sources, beta-carotene, found in orange and yellow fruits and vegetables, such as carrots and sweet potatoes. 8. Iodine deficiency. Iodine is essential for the production of thyroid hormones, which regulate metabolism. A deficiency can lead to goiter, enlargement of the thyroid gland, and hypothyroidism, resulting in symptoms like fatigue, weight gain, and cold intolerance. It is more common in regions with low iodine levels in the soil, particularly inland areas. Sources of iodine include iodized salt, seafood, dairy products, and certain fruits and vegetables. 9. Zinc deficiency. Zinc is important for immune function, wound healing, and DNA synthesis. A deficiency can impair immune response, lead to hair loss, and affect taste and smell. Individuals with gastrointestinal diseases, like Crohn's disease, or those with poor dietary intake, such as vegetarians, may be at higher risk. Foods rich in zinc include meat, shellfish, legumes, seeds, nuts, and whole grains. 10. Omega-3. Fatty acid deficiency. Omega-3. Fatty acids are essential for heart health, brain function, and reducing inflammation. A deficiency may increase the risk of heart disease, cognitive decline, and certain mental health disorders. Many people do not consume enough omega-3s, particularly those who do not eat fish or plant-based sources like flax seeds and walnuts. Omega-3 supplements, such as fish oil, can also be beneficial for those with dietary restrictions.